Striae gravidarum or pregnancy stretch marks is a form of scarring of the skin of the abdominal due to sudden weight gain during pregnancy. These off-color blemishes are symptoms of pregnancy caused by the tearing of the dermis, resulting in atrophy and loss of rete ridges. These scars often appear as reddish or bluish streaks on the abdomen, and can also appear on the breasts and thighs. Some striae disappear with time, while others remain as permanent discolorations of the body. Signs and symptoms. Striae begin as reddish-purple lesions, and, over time, lose pigmentation and atrophy. They can cause a burning and itching sensation, as well as emotional distress. They are rarely harmful, but thought of more as a cosmetic nuisance. Young women are generally affected the most and usually seek treatment for lesions from a dermatologist. And following pregnancy. Striae gravidarum treatment. Various treatments are available for the purpose of improving the appearance of existing striae gravidarum. Learn more about striae gravidarum treatment. Visit the link below. Link in description.